The full moon in March is traditionally called the full worm moon by Native Americans. At this time of the year, the ground starts to soften up and worm casts appear, and that heralds the return of the robins. And since parasites tend to flare up around a full moon, and since some worms are parasitic in nature, I thought I'd talk a little bit about parasites. Parasite is an organism that lives on or in another organism called the host, and it derives its nutrients from the host at the expense of the host. The Center for Disease Control in the States has an alphabetical classification of parasites. So if you Google the CDC, you can get an alphabetical list of parasites and the diseases that they cause. Generally, there's three classes of parasites: the protozoa, which are usually waterborne, the helminths, or worms, and ectoparasites, which are insects which become vectors for the diseases that parasites cause. Some common parasites are bed bugs, body lice, pelvic lice called crabs, pinworms, hookworms, tapeworms, H. pylori, which is a parasitic bacteria that causes ulcers. So those are probably the more typical parasites that you've probably heard of. One can get parasites from water. This is both drinking water and recreational water. So the water that you swim in, whether it's a river, lake, pond, swimming pool, hot tubs. It's usually water that's contaminated by fecal matter from domesticated as well as wild animals. You can get parasites from food, meat that is undercooked or raw, as in is raw fish, and fruit that are grown on fields that are fertilized with human and animal waste. You can get parasites from unwashed fruits and vegetables that you're eating, salads. You can get water or aquatic type vegetables like watercress that's not been properly washed. You can get parasites from the feces and urine of animals like dogs and cats. So you have dogs and cats around. The cat litter is a big source of one called Toxoplasma gondii, which causes toxoplasmosis, which can, research has shown actually has an involvement in schizophrenia and actually leads to shrinkage of the cerebral cortex of the brain. So that's kind of interesting. Insects, which can be a vector for the parasites. In other words, if the person is infected with a parasite and say a mosquito bites, sucks the blood, and then they go and bite another person, they can spread the parasite or the disease from the parasite that way. You can get parasites from unsanitary food processing facilities, as well as contaminated workers in the food processing industry. You can get parasites from blood transfusions, sharing of needles, and walking on just good old Mother Earth and bare feet, or working with Mother Earth with bare hands. Any GI problems: constipation, diarrhea, gas, bloating, abdominal pain. I've seen grown adults just crying because the pain is so intense from having a parasitic infection. Traveler's diarrhea, if you have a history of traveler's diarrhea and maybe you've never felt right since, you have a history of food poisoning, you've never felt right since, anemia, iron deficiency anemia, fatigue, exhaustion, apathy, all kinds of skin irritations and lesions, so hives, eczema, rosacea, just rashes, rectal itching, itchy nose, grinding your teeth. Unexplained weight loss, malnutrition, never feeling full after a meal, neurological symptoms, mood symptoms. Again, I talked about the T. gondii affecting the brain, shrinking the cerebral cortex, and even having implications in schizophrenia. Unexplained muscles and joint aches and pains, and insomnia, and disruptions in your sleep pattern. So hard to fall asleep, and you wake up multiple times during the night. Your conventional medical doctor can test for parasites. You can do a comprehensive stool analysis through our office, which would cost, right now it's $220 plus, that's US, plus shipping. That's our cost for doing that test. There's more easier ways of testing. We can use EAV testing or a system called the EDISCAN system in the office, as well as something called total body modification for testing for parasites. One of the best ways to prevent parasites is to wash and cook your food well, watch where you swim, watch where you share, who you're sharing hot tubs with, and watch your animals. If you clean up animal fecal matter in your yard, use rubber gloves. And I would wash the rubber gloves before you take them off, and I'd wash my hands after. And I'd be careful about where letting animals lick your face and your hands, okay, and wash up after that. There are a number of products out there for killing parasites, so you can go to any health food store and they'll have a number of different products with different ingredients. The main ingredients you want to look for are black walnut, wormwood, cloves, garlic, grapeseed extract, the podarcal tea, caprylic acid, pumpkin seed. Increase your fiber in your diet. Make sure that you have plenty of stomach acid. And if you're over the age of 50, you probably don't. So taking apple cider vinegar or some digestive aid that has acid in it would be another good thing to do. And keeping a healthy bowel. Around 80%, 60 to 80% of your immune cells are in or around the intestinal tract, so it's very imperative that you have a healthy bowel in order to have a healthy immune system. So that's another way. And so probiotics is another thing that helps to ensure a healthy bowel. And make sure your probiotics are human strains and they're backed up by some research. In my 35 years of experience, parasites rarely come by themselves. They're often accompanied by yeast, fungus, molds, and what we call a dysbiosis, which is your unhealthy bowel. So you want to maintain a healthy bowel because the vast majority of your immune cells are in or around the intestinal tract. And dysbiosis basically means an unhealthy bowel, an unhealthy environment or terrain in the bowel. So you want to make sure that you're taking probiotics, and you want to ensure that the probiotics are human strains backed up by some research, so that you're taking the right kind of probiotic. A number of years ago, I attended some training for the treatment of autism and autism spectrum disorders. And the lab that we were at was Great Plains Lab in Kansas City. They tested feces, blood, urine, and saliva for parasites and a number of other microorganisms. When they found parasites, which they invariably did in autistic children and adults, they tested for the types of parasites, and they tested natural and drug products for the treatment of those parasites. And they found that while the drugs worked, they only worked for 2 or 3 weeks. The natural products worked as well or better, and they worked for a lot longer. They also found that the parasites were very, very adaptable, and that they would adapt to whether it was a natural product or a drug very quickly, so that they recommended that one takes 3 or 4 different products for killing parasites and randomly cycle through these products. Don't keep taking the same one for a specific period of time before switching to another one. As a summary, parasites flare up around full moons. So if you have any symptoms that seem to aggravate around 2 or 3 days either side of a full moon, you may have a parasite problem. If you'd like to be tested, or if you would want some help in treating your parasites, give us a call at the number shown on the screen, and we can test you for parasites and test for the products that work best on you. Have a great day, and remember, if you ignore your health, it'll go away.